Welcome back, everyone. Today we're going deep into something you might not think about every day, but it's super important in healthcare. Extubation and tracheostomy removal. Basically, we're going to be talking about when and how folks can finally ditch those breathing tubes and, breathe freely again.
It's a big deal for sure.
Yeah. So to guide us on this journey, we've got a lesson plan designed for healthcare professionals. Don't worry, though, we're going to translate all the medical jargon into plain English.
Yeah. We'll make sure it makes sense for everyone.
And we'll focus on what's, actually interesting and relevant for you. So, ready to dive in?
Ready when you are.
Okay, great. So first things first. How do doctors even decide it's the right time to extubate someone? It can't just be like, oh, they seem better, let's just yank this tube out.
Right. There's a lot more to it than that. It's not just about pulling out the tube. There are a ton of factors to consider and things that can go wrong. Yeah. So it's, really important to understand the whole process.
So it's kind of like a pilot deciding when it's safe to land a plane, right? There's a whole checklist of things that need to be in order or else things could get messy.
Exactly. So the first and most important thing is that the original reason for intubation needs to be resolved.
So say someone needed a breathing tube because they had pneumonia really bad and they couldn't breathe on their own.
Right. In that case, they shouldn't be extubated until the infection's gone and they're showing signs that they can breathe on their own again.
So it's not just about whether they can technically breathe without the tube. It's about whether their body's actually ready to take over that job full time.
You got it. Doctors look at a bunch of things like the patient's ability to breathe on their own, maintain their oxygen levels, and protect their airway from things like accidentally inhaling food or liquids.
Makes sense. So let's say a patient seems like they're on the mend, doing well. Are there any specific tests doctors use to make sure they're really ready for extubation, or is it more of a judgment call based on the whole picture?
There's a really helpful tool called the cuff leak test that can help predict whether a patient might struggle after extubation.
Oh, that's interesting. I've never heard of that.
Yeah, it specifically helps identify folks who are at risk for something called glottic edema.
Glottic edema.
Which is swelling around the vocal cords.
Oh, okay, so something you definitely want to avoid. So how does this cuff leak test work? Is it something that the patient even knows is happening?
It's pretty simple, actually. The doctor just temporarily deflates the cuff of the breathing tube, and they measure how much air leaks out around it. A significant leak is actually a good sign.
Wait, really? Why is a leak a good thing?
Well, it means there's enough space around the tube, and the vocal cords are less likely to be squeezed and irritated by the cuff. That reduces the risk of them swelling up after the tube is removed.
Ah, okay, I see. So it's kind of like a pre-check to make sure everything's good before yanking out the tube.
Exactly. It's not always necessary, but it's especially important for patients who are considered high risk for complications.
Like who?
Like kids, women, or anyone who's been intubated for more than 6 days.
Bro, the longer the tube's in there, the more potential for irritation.
Yeah, exactly.
Okay, so let's actually walk through the extubation process now. What are the steps to getting that tube out safely?
It's a really carefully choreographed process, but it might surprise you how straightforward the actual steps are. It starts with suctioning the breathing tube and the area above the cuff to clear out any secretions.
So like mucus and stuff.
Yeah, exactly. That prevents those secretions from going into the lungs when the tube is removed.
That makes sense. You wouldn't want to get the tube out and then the patient starts choking on gunk.
Right, exactly.
So what's next?
After suctioning, it's all about making sure the patient's well oxygenated. Extubation can be stressful on the body, and good oxygen levels help minimize any negative effects on the heart and lungs.
So suction oxygen and then just yank it out.
Not quite. They carefully deflate the cuff of the breathing tube, and they remove any tape or holders that are keeping it in place. This frees the tube up for removal.
I bet that's a pretty intense moment for the patient.
You're right, this next step is key. The doctor will ask the patient to take a deep breath in or cough to open up their vocal cords, and then they'll gently pull out the tube at the peak of inhalation.
Why the peak of inhalation? I would have thought a big exhale would make more sense.
It's actually when there's the least resistance in the airway. Pulling the tube out during inhalation minimizes any potential trauma to those delicate tissues.
Oh, so it's about making the exit as smooth as possible.
Exactly.
So what happens once the tube's out? What are those final steps in the extubation journey?
Immediately after they remove the tube, they'll provide appropriate oxygen therapy, especially if the patient was on a ventilator. This helps keep those oxygen levels stable as they adjust to breathing on their own again.
Gotcha.
And to make things more comfortable, they usually add some humidity to the air as well.
Like a cool mist.
Yeah, a cool mist can really soothe the airway after having a tube in there.
I bet that feels amazing. But are there any long-term effects or issues that might pop up, even if the procedure itself goes smoothly?
You're right, it's not always smooth sailing. Even with the best care, complications can arise.
Like what?
We'll dive into those potential hiccups and how they're managed right after this break.
I'm definitely curious to learn more about what could go wrong. It's amazing how much goes into something as seemingly simple as removing a breathing tube, isn't it? We've learned about the importance of timing, the role of the cuff leak test, and the step-by-step process of extubation itself, and it's all done with the goal of making sure the patient can breathe comfortably and safely on their own again.
It's pretty incredible when you think about it.
It is. Okay, we'll be back in a flash to talk about those potential complications, so stick around. Okay, so we talked about the ideal scenario for extubation, but in medicine, things don't always go as planned right.
You're telling me.
So what are some of the things that could go wrong even when everyone's doing everything right?
Well, even with the best care, complications can pop up. 3 of the most common are laryngospasm, glottic edema, and vocal cord paralysis.
Okay, this sounds pretty serious. So let's say a patient's just had their breathing tube taken out, and all of a sudden they start gasping for air.
Oh, yeah?
Is that what laryngospasm would look like?
Yeah, that's a possible scenario. Can be pretty scary. Laryngospasm is basically a sudden spasm of the muscles in the voice box. It causes the vocal cords to just slam shut.
And what causes that to happen?
Often it's triggered by irritation from the breathing tube itself.
So the airway essentially closes up.
Yeah, it's like a sudden blockage of the airway.
Okay, so what would the medical team do in that situation?
The first thing is to stay calm and provide high concentrations of oxygen. Maybe even with some positive pressure to help force the airway open.
Like a mini ventilator.
Kind of.
And hopefully that does the trick.
Yeah, in most cases, laryngospasm is brief and resolves on its own within a few seconds.
That's good.
But if it's severe or doesn't let up, they might need to give a medication to relax those muscles. And potentially re-intubate the patient to secure the airway until things calm down.
So yeah, that does sound pretty intense. Okay, so laryngospasm is that sudden dramatic event. What about glottic edema? How does that usually present?
So with glottic edema, it's swelling of the tissues around the vocal cords. It's more of a gradual swelling that narrows the airway.
And this can happen even if the cuff leak test looked good.
Unfortunately, yes. The cuff leak test is just a predictor, not a guarantee. Glottic edema can develop after extubation for a bunch of reasons.
Like what?
Like trauma from the breathing tube, a tube that was too large, or even an allergic reaction to the tube's material.
Okay, so how would you know if someone was developing glottic edema? What should people be looking out for?
One of the telltale signs is a high-pitched whistling sound during inhalation.
What's that called?
Stridor. It's a sign that the airway's narrowed.
Okay, so what's the treatment for glottic edema? Does it depend on how bad it is?
You're right, it can be very distressing. For mild cases, cool mist can sometimes be enough to bring the swelling down.
So like what we talked about before, that soothing mist.
Exactly.
And for more moderate cases?
If it's more moderate, they might use medications to shrink the swollen blood vessels or reduce inflammation.
And what if it's really severe?
In the worst cases, they might have to re-intubate to protect the airway until the swelling goes down.
So it seems like with both laryngospasm and glottic edema, re-intubation is a possibility. Now, what about vocal cord paralysis? How is that different?
Vocal cord paralysis is less common, but it's another potential issue. This is when one or both of the vocal cords can't move properly.
Like they're frozen.
Yeah, exactly.
Why does that happen?
It can be caused by damage to the nerves that control them, which can happen during intubation.
So how would you know if someone had this?
The most obvious sign is a change in their voice. They might sound hoarse or have trouble speaking.
Is that the main concern?
Well, the biggest worry is the increased risk of aspiration.
Because the vocal cords aren't closing properly to protect the airway.
Exactly. If food or liquid gets into the lungs, it can cause a serious infection. So in some cases, they might need to avoid eating or drinking for a while after extubation.
So the vocal cords can recover.
Right.
It seems like there are so many things that can go wrong with extubation. Is it common for a patient to have more than one of these issues at the same time?
It's possible, but not usually the norm. Healthcare professionals are really skilled at recognizing and addressing these issues.
That's good to know. Okay, let's shift gears a bit now and talk about tracheostomy removal. Is that basically the same process as extubation, or are there big differences?
There are definitely similarities, but tracheostomy removal has its own quirks. The main difference is that the tube is placed through a surgical opening in a neck directly into the windpipe.
So it bypasses the mouth and throat completely.
Right.
Interesting.
And because of that, the process for removing it can vary. It depends on why the tracheostomy was needed in the first place.
Okay, so walk me through the different scenarios.
Well, some patients might need a tracheostomy to bypass a blockage in their upper airway. In those cases, removing the tube can be pretty simple once the blockage is gone.
So it's like taking the training wheels off a bike.
Exactly.
But for patients who needed a tracheostomy because they were on a ventilator for a long time, it's more complicated?
Right. They might need a weaning process, similar to weaning from a ventilator, to make sure their lungs can handle breathing independently.
So it's not just yanking out the tube. It's about gradually helping the patient transition back to breathing on their own.
Exactly.
What do doctors look for to determine if someone's ready for tracheostomy removal?
There are several criteria. First, they need enough muscle strength to cough effectively. Coughing is essential for clearing secretions and keeping the airway open.
So it's not just about the lungs themselves, it's about the muscles being strong enough to support breathing as well.
Absolutely. They also need to be free of any active lung infections, have a manageable amount of secretions, and a clear upper airway.
So you're really looking at their whole health, not just the tracheostomy itself.
Right.
What about swallowing? I imagine that could be tricky after having a tracheostomy.
Yeah, swallowing is a big consideration. Before removing the tracheostomy tube, doctors need to make sure they can swallow safely.
You don't want food or liquid going down the wrong pipe.
Exactly.
So it's a very thorough evaluation, looking at everything from lung function to muscle strength to swallowing ability. So what happens after the tracheostomy tube is removed? Is that it? Or are there still things to watch out for?
Removing the tube is a big step, but it's not the end of the story. They keep a close eye on the patient for any signs of complication.
Like what?
Like difficulty breathing, changes in voice, or any signs of airway obstruction.
So there's an adjustment period as the body gets used to breathing without the tracheostomy.
Definitely. Their vocal cords might need some time to regain their full function, and they might need speech therapy. The opening in the neck where the tube was placed also needs time to heal.
What happens if problems pop up after the tube is removed?
If complications arise, the medical team can intervene.
Like what kind of interventions?
That might involve things like providing extra oxygen suctioning the airway or even reinserting the tracheostomy tube until things settle down.
So yeah, it really shows how important monitoring is throughout this whole process. We've talked a lot about the technical aspects of extubation and tracheostomy removal, but it seems like there's also a big human element to all of this. What's it like for patients going through these procedures?
You've hit on a really important point. It's crucial to remember that these procedures can be very emotional for patients and their families.
I can imagine.
Just imagine the relief of finally being able to breathe on your own after relying on a tube for days, weeks, or even months.
Yeah, it must feel like a huge weight's been lifted, literally and figuratively.
Exactly.
But I imagine there's also some anxiety and uncertainty.
Absolutely. There's often a mix of emotions. Relief, excitement, but also some fear of the unknown.
So it's important for healthcare providers to be sensitive to that.
Definitely. It's not just about being skilled in the technical aspects. It's about being compassionate and understanding what the patient's going through.
It's a delicate balance of technical expertise and human connection.
Exactly. And speaking of expertise, there have been some really fascinating advancements in extubation techniques. We haven't even touched on them yet.
Oh, really?
Yeah. There's a growing emphasis on using protocols that empower patients to participate more actively in their own recovery.
Oh, that's interesting. What does that look like?
Well, one example is something called spontaneous breathing trials. It's a way to assess a patient's readiness for extubation by giving them short periods of time to breathe on their own while still connected to the ventilator.
So it's like a test run for breathing independently.
Exactly.
What are the benefits of that?
It can actually shorten the overall time patients spend on a ventilator, which leads to fewer complications and a faster recovery.
That makes sense.
Plus, it gives patients a sense of control, which can be really empowering.
Right, because they're not just lying there passively.
Exactly.
It's not just about the physical act of breathing, it's about the psychological and emotional aspects of recovery, too.
Precisely. There's a growing recognition that patient comfort and well-being are key to successful extubation and tracheostomy removal.
So these newer approaches are trying to make the whole process as smooth and positive as possible for the patient.
Exactly.
It's incredible how much research and innovation is going into these seemingly routine procedures.
It is.
It really shows how much healthcare is becoming more patient-centered and holistic.
Absolutely. And this is just the beginning. There are always new developments and techniques emerging.
All aimed at improving outcomes for patients.
Right.
I feel like we've already covered so much, but first, let's throw our listener a moment to catch their breath. We've talked about the possible complications of extubation, like laryngospasm, glottic edema, and vocal cord paralysis, and we've explored the details of tracheostomy removal and the importance of patient-centered care. I'm excited to hear more about those cutting-edge approaches you mentioned and what the future holds for these procedures. Okay, so we were talking about all these new approaches to extubation and tracheostomy removal. What else is on the horizon? Anything that could, really change the game?
There's so much cool research happening. One thing that's super interesting is using ultrasound to predict extubation success.
Ultrasound, like the same thing they use to look at babies.
Yep, exactly. Researchers are looking at whether ultrasound of the diaphragm and other breathing muscles can tell us something about a patient's readiness to breathe on their own.
So instead of just relying on the cuff leak test, you could actually see how well the muscles are working.
Exactly.
Wow, that's amazing. What are the advantages of using ultrasound like that?
Well, it could give us a more objective and accurate picture of the patient's respiratory strength. Plus, ultrasound is non-invasive and pretty inexpensive, so it could be a great tool in a lot of different healthcare settings.
So it's a potential game changer.
I think so.
Are there any other research areas you're excited about?
Yeah, another cool area is personalized weaning protocols.
Personalized, what does that mean?
So researchers are trying to find specific markers in the body and even genetic factors that could predict how someone will respond to extubation.
Oh, wow.
And that could lead to custom weaning plans for each patient. Plans that minimize complications and help them recover faster.
So instead of one size fits all, it's like tailoring the approach to each person.
Exactly.
It's like that precision medicine you hear about with cancer treatment.
Yeah, exactly.
That's incredible.
Yeah.
I mean, it's mind-blowing how much progress has been made in this field. We've gone from these pretty basic procedures to these super sophisticated, individualized approaches.
It's amazing, isn't it?
It really is. So if our listener is taking away one thing from this deep dive, what would you want it to be?
I think the biggest thing is that these procedures are way more complex than they seem. There's so much planning, monitoring, and decision-making involved.
And it's not just about the technical stuff. It's about treating each patient as an individual.
Right.
And tailoring the approach to their specific needs.
Exactly. Whether it's using fancy imaging to look at breathing muscles or developing personalized weaning plans, it's all about putting the patient first.
That's so important. Well, this has been such an insightful look into the world of extubation and tracheostomy removal.
I agree.
We've learned about the steps, the potential problems, and even what the future might hold. If you or someone you know is facing these procedures, remember, knowledge is power. Don't be afraid to ask questions and advocate for yourself. You deserve to feel confident and comfortable with the care you're getting. These procedures might seem scary, but with the right care and good communication, they can be a big step towards breathing freely again.
I couldn't have said it better myself.
Thanks for joining us on this journey into the world of breathing and recovery. Until next time, stay curious, stay informed, and breathe easy.